What is metastatic prostate cancer? Right now, it's the second most common cancer in men after lung cancer. It's quite a silent disease, and a significant portion of the population is detected in the late stages of prostate cancer.
Doctor, don't make this diagnosis lightly. Let's say you step into the clinic because you have some trouble urinating or possibly some blood in the urine. As a urologist, I might be the type of doctor to help you with this. We would do a blood test that helps us check a specific marker. If that is elevated, then we might go on to do further checks, like a scan followed by a biopsy to confirm the presence of prostate cancer. We also need to find out what stage the cancer is at.
Non-metastatic prostate cancer is early-stage prostate cancer. It has a chance of being cured, so in those cases we can work towards that. But for prostate cancer that has metastasized, it means that the cancer that was started in the prostate has now spread to other organs such as the bones, lymph node, liver, or lungs. In those cases, we are looking at prolonging life as the condition is no longer curable.
Prostate cancer is sometimes a slow disease. There are times when it isn't necessary to treat the cancer right away, because the person might die of other more serious medical conditions such as a heart attack or stroke before the cancer claims his life. So such a person might die with prostate cancer but not of it. So in those cases, the best approach might actually be to monitor the cancer closely without initiating any treatment. But if that isn't the case for you, and your doctor does recommend treating it, we have many solutions available today. Prostate cancer is an androgen-driven cancer. That means that it relies heavily on testosterone to grow. So when we reduce testosterone, it kills the cancer. In the past, our main option was surgical castration. I know that sounds terrifying, but it works because it brings the testosterone levels down, depriving the cancer of food. These days, we can still bring down the testosterone levels, but with medication. This is called medical castration. It is very effective and can be as simple as having an injection every 3 or 6 months. Most of the time, the pain starts to go away. The cancer marker levels drop, and the patient has a better quality of life.
The problem is that about 18 months after this, the cancer tends to return. It is no longer reliant on testosterone to continue to grow.
At this point, we can bring another set of tools to combat the cancer. We can use drugs that block the production of testosterone from the adrenal glands. Chemotherapy is another example, and this is much more tolerable these days. Occasionally, we employ radiotherapy to control pain. The combination of these methods will certainly improve the quality of the patient's life. There are now some very exciting new possibilities today that we couldn't even consider a few years ago. For example, we can test the genetics of the patient or the cancer itself to find the weaknesses and see if we can exploit them. If we do find a weakness, there are new drugs designed just for that purpose. Then the patient can use these weaknesses to his advantage and fight the cancer better just by taking a few pills.
Now, it's natural to feel afraid, shocked, or even defeated when you receive a diagnosis for late-stage prostate cancer. It's not an easy situation, and we need to address the reality that there will be prolonged drug treatment for the next several years. But as doctors, we can assure you that we have a whole arsenal of treatments available now to help you and to give you the best possible outlook.
We used to hear the word cancer and think it is a death sentence. But today, cancer can be transformed into a manageable chronic illness. Just like taking 1 or 2 pills a day, that's basically the same as taking medicine for hypertension or high cholesterol. You could have many meaningful years of life ahead, so don't give up.